So, welcome to Kia. I'm excited to chat with you.
Thank you for having me. I'm
You're,
excited.
you're welcome. You're welcome. So, before we get into the nitty gritty, introduce yourself and tell everyone who it is that you work with and why you specifically work with that demographic or that particular specialty.
Okay, so my name is Sakia Maize, and I am a mental health professional specializing in couples and sex therapy, as well as individualized sessions with high achieving Black men and women.
Yes,
Um,
yes, yes.
my passion for this work it's rooted in both my personal experiences along with like professional observations and things that I've seen while being in the field. A
Hmm.
lot of times, the stories of Black and Brown individuals go misunderstood, unheard, or unnoticed, and especially those of high achieving individuals because it's like, well, you have all these things. What are you worried about? How can you be depressed
Right.
if you have all of this? So, because of that, I am a firm believer in being the change that I want to see. So I am using my skills to ensure that I can be that agent of change and allowing those high achievers to know that just because you were blessed enough to have these things does not mean that your feelings are any less valid or that you don't have the right to discuss or complain about problems in your life simply because there's other people that have it worse.
Yes, being acknowledged, especially as a Black woman, being acknowledged that we work really, really hard and we feel like we don't deserve to share like our burdens or that we need to gloss over the fact that we have like burdens and issues and problems. And
Right.
you're right, people do look at us and say, "Oh, but you're doing so well. Like you have this great job and you live in that big ass house down the corner." And but the reality is a lot of that comes from checking off the boxes. And I think you have probably seen with working with couples that sometimes you have to get to the root of some of the things that you've done when you didn't want to do it because of what people told you in order to show up as your best self in your relationship.
Absolutely. I feel like that is a big thing that's often missing, especially because when you are generally, when people are high achievers and they are setting these goals, it's check boxes of things that they want to achieve. However, no one considers their emotional well being
Hmm.
in the process. No one, there is no checkbox for your mental health. There is no checkbox for your emotional well being. And it can become overwhelming, especially when you perceive that you have to show up and present a certain way because you're the strong one. And everyone
Hmm.
always gives you that title. So now you feel like you have to basically acclimate yourself to becoming that. And that's not always the case. So I really, really stress and emphasize to my clients that it's okay not to be okay. You don't always have to be the person that has it all together. You don't always have to be the person with all the answers. And being strong does not mean that you don't have feelings.
Right. Being strong is exhausting.
Mhm. Mhm.
So, what's one thing you want people to understand about your work with couples and even with some of these individual clients that you have?
The biggest thing that I want individuals to know about mental health services in general, not even just with me, you don't have to wait. You don't have to wait for things to be bad. You don't
Hmm.
have to be crazy to seek help. You don't have to have everything crashing down and burning before you finally reach out.
Absolutely.
Instead, it's better to honestly be more proactive so that we prevent the burnout and the crash out phase of things. And I say that because a lot of times when I tell people that I'm a therapist or I suggest to people, like, hey, that's something really triggering that happened to you, maybe you should consider therapy. It's always like, I'm not crazy or it's not bad enough yet. When I can't handle it, then I ask for help or I got this. And it's like, yeah, you may perceive that you do. However, high functioning depression is very real in
Hmm.
professionals. So, yeah, you may think that you're holding on, but you're really not. So, the biggest thing is to seek help on the front end of things versus the back end so that it's much easier to do proactive preventative work than trying to go in on the back end and be reactive to fixing
Hmm.
all of these things that have already happened. So, my biggest advice, do not wait. Therapy is for everyone. Anyone having any type of problem, anyone that just needs to express themselves, because having a safe and welcoming space just to be you and express how you're truly feeling without any pressures or limitations or anyone expecting anything. Because when you come to my therapy sessions, I'm not expecting for you to present as anything other than who it is that you are.
Well, that was a mouthful, Sakia. I love it. Huh, we can tell you do this. You do
Yes,
this.
yes, yes. And I'm very passionate about it. I love everything about being a therapist. So I can literally talk about it on and on and on and on and on and on. I believe in it. I know there are some people that's like, I don't need anybody in my business. And it's like, I'm not here
Mhm.
to be in your business, girl. I'm here to help you. Yeah.
Yeah. Yeah. So, what's your approach working with your clients, especially working with couples, and how do you integrate holistic wellness into your sessions?
That's a great question. So I, again, remind my couples that I am here to help. I am not here to tell you what to do with your relationship. I am not here to determine what happens next in your relationship. I am simply here to help guide you through whatever challenge it is that you guys are facing now to ensure that we can find a common ground. So I always take a more strength-based approach to my clients and seeing like, okay, what's working well, what's not, and how can we bridge that gap. I'm also have a solution focused approach with my clients because yes, it is important to discuss the why and see what kind of caused the situation. However, dwelling on the problem is not going to help us move on. So
Mm-hmm.
I like to take a solution focused approach so that okay, we know what the problem is. Where is it that we would like to go from here? And now through our sessions, we figure out the journey of how we get there.
Right. And so, for people that may be thinking, I don't like to put it all on the men, sometimes it's the women too. But those that say, if I come to you, you're probably going to be skewed towards my wife, especially being a Black woman and, all of the things. I can't trust that as a man, someone is going to be on my side and hear me out in this couple session. Because I've heard a lot of times my partner doesn't want to come to therapy because he doesn't think that he's going to be listened to and that everyone's going to point the finger at him and gang up on him. So, how do you kind of navigate those fears?
I re I continue to explain my position because
Mhm.
at the end of the day, I do not benefit anything by ganging up on one individual person. My goal is to help you guys move forward. In order for me to do that, I have to be able to listen to both sides and hear both sides. I would not be able to effectively do my job by only listening to one person and siding with one person. And again, I am a huge believer in therapy and I definitely believe that it works. But in order for it to be effective, it has to be done right. So I would never approach a situation with a bias, especially towards one individual, because that defeats the purpose of what it is that I believe in. And I believe that we both, myself and the clients, have to show up ready to put in the work and do the work. And I would be doing them both a disservice if I came in simply like, okay, I'm going to listen to what the wife is saying, forget what you're saying. I
Mhm.
don't believe you. I Right is right and wrong is wrong, whether it's the wife or the husband. Sometimes neither party is wrong, and they just have a comprehension issue when it comes to communication. And sometimes you don't really understand what the other person is saying. Uh,
Mhm.
so a lot of the times, and I just tell the husbands, you're probably not wrong. She's probably not wrong, but I wouldn't know either way until I had the chance to hear you guys out. So, can you give me the chance to hear you out? And I tell people all the time that therapy is not mandated. I'm not mandated by any courts, by any lawyers,
Mhm.
like that. So give it a chance. And if at any moment you don't like it or you feel that it's biased or anything like that, we can stop at any time. And that kind of gives them the reassurance that they are in control of things and that they can stop it at any moment. Because again, it's not mandated. So give me the chance to be non-biased. And if you feel that there's any bias or anything going on there at any moment, we can stop. No hard feelings, and you don't have to continue in services.
Right.
That approach typically goes well because they don't feel like they're locked into anything. We can kind of just see how things go, try it out because
Mhm.
therapy is not a one size fits all. And while I do believe I am a great therapist, I may not be the best therapist for every single individual, which is why there's a bunch of people who do what it is that we do, right? So we can try it out. And if it does not work well, that's fine. We can get referrals for other therapists or we can discuss other options. But I always do remind them that you are in control here. So if you would not like to continue, we don't have to. But how would you know if it works if you don't want to give me a try?
Love that. I love the clarification of nobody could be wrong. Like
Mm-hmm.
that's a possibility that nobody is wrong. And it's just about how do we find a middle ground or how do we hear each other? How do we communicate so that we can actually be heard? Because the arguing and everything like that, no one's listening. No one can hear anything. So being able to have you there to reiterate or even change the verbiage of what's being said. Because as therapists, when we're with someone long enough, we learn their communication, we kind of adapt. So it's very easy to say, okay, what did you hear? That's not what was said. Like, I'm going to show you how I can poke holes in what it is that you're hearing. This is what is actually being said. And that's usually what it is. Like, they then made up a whole story in their head of this one sentence that does not go with the sentence.
Absolutely. And sometimes the struggle can be not just on the listener, but the person who's communicating. And
Mm-hmm.
this is something that I also tell my clients. You only know what you know. A lot of people do not have the emotional intelligence to be able to accurately explain or express what it is that they're feeling. So while they may be saying, you made me mad because X, Y, and Z, maybe what they really meant was, I was embarrassed, but they didn't have the words to say.
Mm-hmm.
So being able to help them really and truly understand and be able to identify what it is that they're feeling and appropriately communicate that, I've noticed have had a lot of success because again, I would say 90% of the time it is communication issues. And
Right.
it's either you're not communicating what it is that you want effectively, or you're not being transparent and honest about it, or maybe you're
Mm-hmm.
not receptive to what it is that is being presented.
Mm-hmm.
Uh, it's very rare that it's like you guys hate each other and you don't need
Yeah.
to be together. And it's mainly, no, this person said this and you took it as this. So you reacted like this and they reacted like that. And now we're in a big problem when it
Yeah.
all could have been resolved if we just communicated it this way.
Right. Right. And I think it's important to recognize that though I say male female relationship, we have seen this across the board. It doesn't matter who's in the relationship, male, female, 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 male, but it does not matter. It's all the same underlying issues that I've seen, and I know that you've seen. Is it's the
Yeah.
communication, the defensiveness, the talking to be heard, not to be listened, and not being able to manage your emotions when you don't like what you hear. We're not always gonna like what we hear in a
As, as
relationship.
Another big thing that I notice is the lack of accountability when your intention does not match the outcome. So because
Mm-hmm.
you intentionally did not hurt this person, however, your actions hurt them. A lot
Mm-hmm.
of couples, well, a lot of individuals are unable to differentiate the two. Well, I didn't
Mm,
mean to hurt you, so why are you mad at me? And it's like,
right.
you may not have intended to do that, but you did. And we can't move forward if you don't acknowledge it, because then that just means the behavior is going to repeat itself.
Mm-hmm. Absolutely. Absolutely. So, what is a myth that you hear or people bring to you about whether it's sex therapy or couples therapy that you frequently have to kind of like break down and say, no, that's not true?
Therapy doesn't work. Therapy is only for crazy people. I tell people all the time, I have been doing therapy for a while. I, I could probably count on one hand the amount of crazy, and I hate the term crazy because what does it
Yeah.
mean? What does crazy even mean? But
Mm-hmm.
for the sake of societal norms, I've owned crazy. That is not true. That is not true because someone with a severe mental health diagnosis will benefit the same amount as someone with adjustment disorder. They simply had something in life happen recently and they're having a hard time adjusting to it and they just need someone to talk to. Having a safe place to express your feelings, I believe, would make the crime rate in America go down a lot because a lot of times people are just frustrated and acting based out of that frustration. They
Hmm.
don't have a safe space. They don't have anyone to talk to. They don't have anyone that they feel like will understand or listen to them. So, no, therapy is not for crazy people. Everyone deserves a safe space to express their feelings.
I love that. And so, someone that might be listening or someone that might be watching, and they're like, I see myself in what she's saying. What do you feel like would be the first step you would encourage them to take?
I would encourage them to go on Psychology Today and just browse through the different types of therapists that are available because, again, therapy is not a one size fits all. And I feel that sometimes people will get the momentum because it's very hard to ask for help to begin with.
Hmm.
So, even take that step into reaching out to a therapist and then you have a bad experience, it's like, okay, you see, I knew this wasn't for me.
Hmm.
However, you would not just go to any old person to go get your eyebrows done.
Right.
You would not go to any old person to go get a lineup. So why would you just go to any old person for your mental health? And
Hmm.
I like to use that analogy a lot because, especially in the Black community, your appearance matters. And you're not going to just go to any old person to do your eyebrows
Right.
because that's
Right.
on your face and it matters how it's done. So, the same effort that is taken into your appearance or into things that you care about, you need to
Hmm.
take that effort into finding a therapist that aligns with you. Because at the end of the day, yes, with therapy, what we do is amazing, but everyone has a different approach. Different life experiences causes therapists to take a different approach to services. And I would hate for someone to be brave enough to take that next step to seek help and then get discouraged because they are not met with a therapist that meets their needs. So I
Right.
encourage everyone to go on Psychology Today, read the bios, see what resonates with you, think about what it is that you need in a therapist or what it is that you need, what type of support it is that you're looking for, so you are able to narrow down your search.
Those are such good ideas. And I like to always explain to it as dating because it can be really hard, especially in this economy where if you're looking for a black therapist, the percentage of black therapists is very low. And 9 times out of 10, a lot of them are already full. So when it comes to systems and reaching out, I've heard a lot of people say I go on Psychology Today and no one ever gets back to me. But that shouldn't be a deterrent. It can be very frustrating, even for us as therapists looking for therapists. We go through the exact same thing, but it's just like dating, right? You don't decide, oh, I'm just going to be but let me take that back because there are some people that think that. But for most, right, we don't date one time and say, "Oh, this was trash. This person treated me horribly. I'm never dating again." No, eventually, you heal the wounds as much as you can and you get back out there and you try again. There's a risk to dating. You probably will get your feelings hurt, and it's not a probably. Even in really healthy relationships, you will get your feelings hurt.
Right.
It doesn't mean don't go looking. So because one therapist didn't work, doesn't mean you just say, "Oh, I'm never going to therapy again." Your therapist is out there. Your person is out there, and when you find it, it's an amazing relationship.
Yes, it surely is. It surely is. And don't just jump into the first opportunity that presents itself. There's a lot of gimmicky thing
Hmm.
now because mental health and self-care and therapy is trending at the moment.
Hmm.
So we have a lot of the things that I personally don't agree with,
Hmm.
bigger things that I feel are kind of like baiting people in and they're having terrible experiences or
Hmm.
their mental health is not being taken seriously. Another piece of advice I would give, you cannot get mental health help from Instagram. Instagram post is not therapy. Reels, TikTok, it's not therapy. That's not going to cut it. Going to your favorite therapist, mental health person's Instagram and looking at the post they post, that's not enough. That's not enough. We need to actually speak to someone, get out there and do the work. So do your research diligently, but let's actually go and help. And I feel like that's why I'm kind of on the fence with this whole social media thing, only because I feel like there's so much information out there
Hmm.
with the lack of credibility for the sources. So we don't know if this person is a licensed professional or a professional in general, but we're taking this advice and we're running with it, which is why
Mhm.
everyone thinks that everyone they know is a narcissist and everyone that they know is like, it's all because this trending buzzwords that you're hearing. And it's like, oh, and everyone thinks they have ADHD and everyone thinks they have depression and anxiety. And it's not necessarily because you went and sought help or you've seen things, it's because that is what's trending on the internet. And there's a lot of predatory behavior on the internet and people are pushing these narratives that benefit them. So I just encourage everyone to do their research thoroughly so that we can try to make informed decisions and
Mhm.
avoid as much of the heartache as possible.
Yeah, understandable. So, for you being one of those diamond in the rough therapists, how do you help your clients see a transformation? How do you walk them through? I'm coming to you because I'm in survival mode. I don't know what to do. I don't know how to pick this apart. To I feel great. Life is different. Like I'm doing the things that I want to do. I'm actually living my life.
First things first, I always have my clients figure out what the end goal is.
Hmm.
Because we can be working towards a lot of things, but if you don't have an end goal in mind, you're kind of just grasping for the air, hoping
Right.
that one of these ropes will pull you up. And I don't feel that to be effective because how do we measure that progress? So
Hmm.
first things first, what is it we're hoping to get out of life? Forget therapy because whether I'm able to help you or not, I would still like for you to leave this session understanding what your goals are. So
Hmm.
now, even if you don't, I'm not saying you have to know specifically, like, I need a 3 bedroom house and this and that. Not necessarily that, but how would you like to feel? How would you like for your life to look? Okay,
Hmm.
now we know what we want. Where are we currently? In comparison to your
Hmm.
dream life, where are you currently? So that we know what areas we need to work on, so that we can create an effective plan that's actually targeting the specific areas now, so that we can work on progressing towards where we need to be.
I love that. And so, one of the questions that I always get in consultations, and you may have gotten them too, is how long does this process take? When will I be okay? And so, how do you respond to that?
I tell everyone that I have no way of answering that question because while I would love to tell them if you come in and you are committed and you do the work within 3 to 6 months, we can discharge you and life is going to be great, rainbows and sunshine. That's not always realistic. Everyone's journey is completely different. Everyone has different stressors and different factors that is um, playing a role into what it is that they're experiencing. And we can be in therapy making progress towards what it is we're working on now. And a month into therapy, 4 different things has transpired
Hmm.
that we now have to work through because, again,
Yeah.
life does not stop life and because it sees that you're trying.
Hmm.
So there's always going to be something going on that may or may not impact how long therapy is. So I tell everyone I will never hold you longer than you need to be held. My goal is to get everyone down to maintenance and eventually not have sessions. However, the process and the journey will look different for everyone. So I never want to give any sort of timeline, to give any false hope or expectations, because sometimes if I say, well, typically clients dealing with these things that you've told me, within 6 months to a year, they're done. And then we're a year and a half in, and you're like, oh, feeling like a failure because you're not
Right.
meeting these timelines and deadlines. Everyone's journey, timeline, and deadline will be different, but we will constantly check in on a monthly basis to see kind of where we are with your goals, if you're feeling like anything needs to change or adjust, and how comfortable you're feeling with decreasing. Because again, the goal is to get everyone to maintenance.
Absolutely. Absolutely. So, for you, what is one thing that you do when it comes to your self care? Because here we're big about self care and rest and taking care of ourselves. What's one thing that you recommend that you do?
So I am actually on a journey of finding a hobby because, as you know, Natasha, I always have my
Mhm.
hand in a million different things. I don't
Yes.
know how to sit down. So I am exploring different hobbies at the moment so that I can do something that one is not tied to a profit because
Hmm.
that's not a hobby, that's a part-time job.
Right.
So I've been exploring different hobbies, and the most recent ones have been gardening and
Hmm.
crocheting. So I have a whole little garden on my patio, which has been nice, and I've started crocheting.
I love that. And you know what I have found because I garden too, and I have a client that is kind of like she lights up with that. And so us doing the work of finding hobbies, because 9 times out of 10, we're talking to our clients, they probably need hobbies too. And so
Mhm.
it gives something to allow them to trust us more, to see that no, oh, you actually doing the same thing that I do. And so she loves to show me her garden and she likes to take me out there to see everything and she's working on her patio. And despite everything that's going on in her life, that hobby, that thing is what allows her to hold on every single
Absolutely.
day. So I think it's important for people to know in this practice, we legit are no different than you, like at all. 9 times out of 10, somebody will say, oh, I'm a few steps ahead of you. But the reality is, for us in this practice, we're literally going through the exact same thing. Maybe yesterday we went through it and you're going through it today. And so that's what I appreciate with all of you is you don't mind including your real life experiences for your clients. So now crocheting, you may end up having to crochet with somebody during a session just to calm them down and, to help them with their anxiety or to allow them to open up more. Or you may need to be talking about the garden and the vegetables. So it just opens up the conversation even more for you to be relatable to your client.
Absolutely. Absolutely. And I found that to be helpful. And because I am a woman that wears many, many hats, I find it pretty easy for me to
Mm-hmm.
relate to my clients because I always have so much going on. And if I haven't done it yet, I'm either thought about doing it or or
It's
something.
on
So
the
there,
list.
yeah,
It's
or
on
it's
the
on the
list.
list and it will be done soon. So it's very, very easy for me to relate to my clients, and we always have something to kind of um, fall back on when it comes to showing them that they're not alone.
Mm-hmm.
That's actually something that came up in one of my recent sessions. My client was like venting and she was like, I wish I could be like you and have it together. And I was like, girl,
Oh,
like me, like me, little do you know, like I am human. Life does
mm-hmm.
not stop for me because I have a title or some letters behind my name at all.
Yeah.
Life continues to life the same way. So I'm experiencing a lot of what my clients are experiencing. And I tell them the only difference between me and you is I have emotional intelligence and you are learning it.
Hmm.
That is
Yeah.
the only difference.
Yeah. Yeah. And I think sometimes that can be the downfall of this therapy world is people sometimes give us this superhuman superhero status where it's like my therapist doesn't go through anything and this, that, and the other. And then they catch you in a moment or catch you in something and it's like, oh,
Not perfect. You're
right.
human. Yes, that's why I remind everybody all the time I am not perfect at all. And I am a human. So the same way you are.
Hmm.
Do not put me on a pedestal because I am no different than you.
Yeah. Yeah. So what's one thing, if you could say anything, that you wish every black couple or even just black woman what they my lips are all what is one thing you wish they knew?
It is okay to say no, and your no means as just as much as your yes does.
Yes.
Um, I feel like because the Black woman is looked at as strong and independent, you don't really have a lot of times they struggle to say no
Mm-hmm.
because if saying no means you're not showing up for this person,
Right. Right.
sometimes you need to show up for yourself. So it
Mhm.
is okay to say no. And also, no is a full statement. You do not have to say no because, or, well, I have no. That's it. My answer is no. I do not owe you an explanation. I do not have to justify why I will not be doing something or why I choose not to do something. No, period.
Yeah.
No
That's
is a
my
full
favorite
statement.
word.
Yes, no. Like I tell people all the time, I am able to maintain through all that I have going on because I am not scared to say no.
Mm-hmm.
I don't feel the need to put others' needs above my own. other people's urgencies does not have to be your burden.
I
It's
like
okay.
that. I like that. And I think that Takia may put us ahead of people. You know, when I say that we're where people are, that may actually put us ahead of people because most people don't feel comfortable saying no and they don't realize how much space you open up when you say no more than you say yes, because then you actually have the time to do the things that you want to. Like, I've had people say the same thing to me: you're doing so much. Like, how are you doing it? Well, I only really do things that I really, really want to. So it doesn't feel like it's taking up a lot of my time because I love it. I enjoy doing it. So
That's
it's
what
not
I
a
have
problem.
all the time. That's all the time. They're like, you have so much going on. Yes, but everything I have going on is things that I want to have going on. I
Mm-hmm.
enjoy being a therapist. So all the things that come with me being a therapist, people when they find out that I have sessions late at night, they're like, why would you work so late? I'm talking to my clients. Like, I don't even know what you're talking about. I'm not even working right now. I literally talk to my clients. So I enjoy what I do. But if I did not, no,
Right.
no, absolutely not. There's always going to be times where people are going to try to get you to
Mm-hmm.
sway on your no. A lot of times people don't even try to get me to sway on my nose because I have already set the standard that my
Right.
nose mean no.
Right.
You can't convince me. Once I say no, once my mind is made up, you're gonna have to come up with a very compelling argument to get me to change it.
I
Uh,
love that you've taught people how to treat you and how to engage with you, and you see the proof that they still love you anyway.
yes, yes, yes. And I tell my clients all the time, you tell people how to treat you. People only do what you allow.
Mm-hmm.
These people keep hurting you is because you keep allowing. And that's why I always teach the art of saying no before teaching boundaries because
Mm-hmm.
boundaries sound good, but they mean nothing if you won't stand on it. That
Mm-hmm.
is the hard part about it because, again, it's trending just like narcissist is at the moment. So
Mm-hmm.
everybody's like, I have boundaries. I'm setting my boundaries. But if I push your boundary, you're going to fold and you're going
You
to allow
fold.
it. So, are you really setting boundaries? No,
Mm-hmm.
not really. You're setting guidelines that you would like for people to follow, but if they don't, it's okay. Absolutely not. I teach
Absolutely.
the art of saying no, and then from there we go into boundaries. Because if you can't say no, having a boundary makes no sense because they're still going to do what they want because you're still going to allow that.
Mm-hmm. I love
Once you
that.
can say no, you're able to stick with your boundary. And I am a firm believer in that. You teach people how to treat you. Everyone's always like, oh, you're so spoiled. People treat you. No, that's just, I set a standard. And if you're not willing to meet my standard, you're not going to be in my life. That's just not, I'm not willing to compromise what it is that I feel like I want in my life simply to make
Mm-hmm.
other people happy.
I love that. I love that so much. So, do you have like a podcast or a book or a resource that you frequently recommend to your clients?
Um, I don't necessarily have a podcast that I recommend, but I do recommend progressive muscle relaxation. A lot
Mm-hmm.
of my clients are always like, I don't have time to relax. I don't have time to do this.
Mm-hmm.
Progressive muscle relaxation, you type it in on YouTube, there's a video that's like 2 minutes long, and then it's up to like 5 minutes. You have five
Oh.
minutes to sit, put this video on, and relax your body. And it really helps. So I tell everybody if you're having a bad day, you need a moment, you need to recenter, but you don't necessarily know how. Or for people that struggle with meditation because you can't quiet your mind, put the progressive muscle relaxation video on, and it will help you force yourself into relaxation, basically.
Oh, I have never heard of that. I need to go look at that. You just gave me a resource, girl. So, for someone who's never been to therapy, but they're curious and they're like, okay, I like what she's talking about, what would you want them to know about what it's like working with you? I mean, I think you've done a really good job throughout this kind of explaining it, but do you feel like there's anything that they need to have at the top of mind when working with you?
Yes, if you are looking for the clipboard in hand, sit on my couch type of therapist, I am not your girl. I, of course, am very professional. However, the way that I presented today in this interview, this is me. This is exactly how I present in sessions, and I am just me. So if you are coming to sessions, I promise I am always going to be professional, but I am not going to be okay. Lay down
Right.
about your feelings. I will call you out when you're not doing what you said you were going to do.
Hmm.
I hold you accountable. So if you are not really ready to do the work, I don't think that I'm the best therapist for you because I will hold you accountable on your goals. We will ensure that you are engaging with the things that we set forth together. Because again, I my clients lead therapy.
Hmm.
I do not tell my clients what they need to work on. I do not tell my clients what we need to do. They're the ones that's in control. I am here as the agent to help you. So I am going to make sure I keep you on that path. So if you do not like accountability, I am not the therapist for you.
It's real easy to say what you don't want in a therapist so that you don't come this way. But I appreciate that in this chat. And Takia is taking new clients right now. She takes Aetna and we do self-pay. So if you need to come talk to Takia, you schedule your consultation and see if it's a good fit. Thank you so much, Takia. I enjoyed talking to you. You have so much knowledge and you have the life experience and the letters behind your name to back it up.
I really appreciate you for having me today.